Pressure is also very important because pressure could affect, we'll learn this later, affect your oxygen and carbon dioxide level. So how do you live, how do you survive in this constant changing world, okay? Again, it's the word homeostasis, okay? Homeostasis is pretty much your average or normal range, okay? That's of your body, okay? Things we need to learn later, okay? For example, these are blood vessels and these are cells, okay? One of the terms that we need to know is intracellular. Intra means inside the cells, extra means outside the cell, okay? So this is a cell. If you look at another cell here, this is the intracellular, okay, inside the cellular, okay? Anything outside the cellular is called extracellular fluid, but don't confuse interstitial fluid with intracellular. Intracellular is inside the cell. Interstitial fluid is part of the extracellular fluid. Okay, we'll learn all that later, so don't worry. And across each cell, there's a membrane. The membrane is what keeps everything out or put everything in or allow certain things in and push everything out, okay? To be in homeostasis, deviation, change, or stimuli from the set point are reversed, okay? For example, you have a stimuli here. Your body will first sense it. Then it will control it, whether it's bringing the temperature down or bringing it up. The effector is the result, okay? Affecting the stimuli. For example, your body temperature, nerve cells in the skins and brain will sense it. You have different receptors in the body, temperature regulatory system in the brain. It tells you, oh man, you're too hot, you're too cold. Then you start sweating or not, okay? Sweating through the body to control the body temperature. So this is one of the way your body responds, okay? The way the body senses it is controlled through the CNS. CNS stands for central nervous system. Every time you see CNS is central nervous system. Or PNS is peripheral nervous system, anything that's not in the center. So central nervous system would be considered your brain and your spinal cord. Peripheral nervous system is anything away from the center. And the effector, how you respond is you use muscles or glands. Okay, one of the things to remember is the difference between negative feedback and positive feedback. So normally if you change something to return to homeostasis, you need to make it in the opposite direction. It makes sense. If you're too hot, you want it to be colder. Okay, if you're too cold, you want it to warm up. So it's opposite direction. So negative feedback is the rule for homeostasis. So if you are too hot, your body will use negative feedback to bring you back to homeostasis. Okay? If your heart rate is beating too fast, again, homeostasis. Negative feedback to bring you back to homeostasis. But what is positive feedback? Occasionally, sometimes we want to increase the stimulus. For example, if you are about to have a baby, okay, your body is contracting, you don't want it to stop because you want the baby to come out. If you go through the negative feedback loop, which makes the body stop contracting, baby's not going to come out. So you use positive feedback to increase the stimulus so that the baby will be pushed out. Blood clotting is another one. When you have a cut, you don't want the blood to stop. Well, you do, but at the first stage, you use the blood to build a clot, the white blood cells, and then just flush out some of the things, and then eventually your body will go into a negative feedback loop. Here's another example of just homeostasis. When you're breathing in and out, your body actually, your blood vessel, your kidney will sense how much oxygen and carbon dioxide it has, and then it will tell the heart to beat faster to provide more blood or less blood, things like that. So this is where you Kahoot, which is just go into the you learn, see if you can recall some of the things. Now we're going to go to the next part. Okay, so in anatomy and physiology, you're going to learn a lot of anatomical terms. Okay, medical community has their own lexicon. Lexicon is their own vocabulary, just like a law. If you're a lawyer, you have your own terms that make your profession unique. Okay, and then you can communicate with your own profession using these terms. So it's not to make things harder, but it's to make your profession unique, and you can communicate with one another. Okay, so we're going to learn a lot of these terms. A lot of them are tongue twisters, but you say it enough, you're going to get it right. Okay, so the body is divided into regions. Okay, so we're going to learn all these regions. Okay, not all of them, but most of them. Okay, so of course the front view, we call it anterior, and the back view, we call it posterior. Okay, later on you'll learn cephalic is the head region, cervical is the neck region. This is the dorsal or thoracic area. Okay, here's the lumbar area, sacrum. We're going to learn those later. Okay, upper limb, lower limbs. So when I told you about the CNS, so the brain is inside here, and here's the spine, spinal cord. So this will be considered the CNS, and anything out to the limbs will be considered PNS, peripheral nervous system. Okay, so that's this part here is the front view. I call it anterior, and this is the posterior. Now notice the hands. Okay, they're pointing outward like this. So when you lie down, the reason they have it like this is when a person dies, they lay on the table, their hands are like this. So they classify this as the anterior view. Okay, and more anatomical position. So we're doing position right now. Okay, so anything that you go toward the head. Okay, so let's say you wanna say that, oh, he's got some burn mark, or the cranial portion is less than the caudal portion. So cranial portion will be going toward the head. The caudal is going downward. Again, here's the anterior, and here's the posterior. Okay, another term that is equal. Anterior is the ventral portion, okay, and posterior is the dorsal. Now, just if you get confused, just posterior is the back. Dorsal is like imagine a fish that has a dorsal fin, so that would be the back, and ventral is the anterior portion. Okay, of course you need to know your left and right, but not your left and right. It's the patient's left and right. So if we're talking about this arm, okay, if you're looking at it, it will be your right, but it's actually the left. If we need to, talk about the anatomical position. Anything proximal is closer to the middle. Anything distal is far away. For example, the kneecap is in the middle, okay? And here's the hip joint. The hip joint, then you say the